Hi there, my name is Renee Golson, and tonight I would like to share with you how to use the Acute Care patches by Rodan+Fields. Now I say tonight because you need to use this system at night. You want to fill a wrinkle as you sleep. So let me show you some techniques on how you can get the most out of filling your wrinkles. Okay, here it goes. Okay, Acute Care, it comes with 10 packets. They're pairs. So the regimen follows where you put the little you put the little patches on, and you wear them Monday, Wednesday, and Friday for 3 weeks, and then one more Monday. And that'll give you the 10 patches, okay? So tonight I want to show you how you can also use the AmpMD roller with it. This will maximize your results of getting the peptides and the hyaluronic acid in deeper to the skin, which will help you fill the wrinkle faster and better. So if you have this, this is how you use it with it. Okay, so as you know, this is the patented roller. It has 1/32 of an inch needles, and what you do is you roll all over your skin just like this. Now if you're new at this, you want to roll in one direction, then pick it up and roll perpendicular or in the opposite direction. So I've been doing this for a while, so I just roll and I don't pick it up, I just move it along. But that's because I'm confident in what I'm doing and I'm used to doing it. So here we go. So I'm gonna roll over here. I like to roll my eyebrows, and I like to roll the top of my lids gently. Do not roll your eye. Be careful. So I roll through here so it will pick up my heavy lids because I have hooded lids. And then I like to flatten out my wrinkle areas so that I can get the little needles into those areas a little bit better. So I roll and I roll. There we go, just like this. So I'm going to go every direction and turn it. Now if this were brand new, I might pick it up a little bit more because the needles are just a little bit sharper. But because I've taken care of this tool, I've gotten at least a year out of it. And that's what you should get. So these lines through here, I want to flatten out. And then I want to roll them. And I want to roll over my nose, kind of make the area flatten so I can get in those little hard to reach areas. So I roll all over and I furrow my brows. So I want to make sure I get in between because I'm a very expressionate person. And so I've earned my expression lines. Okay, so I've rolled my face, I've rolled through here. Now don't forget, you want to roll your neck because as we age, unfortunately, we lose elastin and collagen. And so I'm going to roll it sideways here. And so by rolling, we stimulate, it's a catalyst for the skin to fill in elastin and collagen. And isn't that what we want? So I'm going to roll down here. And if I have areas, I like to spread them apart. Again, trying to flatten that skin out to get in a little bit deeper. So we call this the best minute of rolling each night. Okay, so if your skin is a little tingly, that's normal. If you have some redness, which I get redness if I touch my skin, that's all very normal. Okay, so normally with the roller, what you do is you use it, you rinse it under warm water, shake it off, then you're going to put it right back in its cradle. And it was designed to never touch the countertop. So look at that. It doesn't touch. Okay, so you do that, you put it on the counter, you let it dry, open, and then what you can do is put the lid on in the morning, just like so, and then it's protected. You can put it in your bag to travel with it by putting something like a hairband around it. This is also a really great way to keep little kids, little people in the house from doing anything to it, okay? So we're going to do that, set that to the side. So now what I'm going to do is I'm going to kind of scope out my face and figure out where am I going to put these little electrodes. They come in each individually, this is a pair, and then as you take them out, they look like this, okay? So you're going to open them up on the sides. They package them beautifully, just like so. You're going to open them up like this, and they're like little smiley faces, but they're little Band-Aids. So what you're going to do is you're going to take them out and you're going to kind of scope them around your face. I usually use them under my eyes, just like this, okay? And because my lashes are long, I have to tuck them under my lashes. So I normally put them here, okay? But I've seen many people try to put them kind of over their eyebrows over their little expression lines up here. But today I also want to talk about how to use them around your lips, because as we get closer to 50 and 50 plus, we tend to get more wrinkling around our lips. So make sure that when you roll it, you really roll the lips. Don't be afraid, let me bring this back. Don't be afraid to roll over the lips, on the lips, roll under the lips. Really roll it, because notice when I do this, these little lines, those are what we're trying to fight against. That's aging. Sometimes we've, either we use a lot of strolls, we pucker a lot, maybe we smoked in our past, or we still do, and we don't like the after effects. So this is a way to roll them. Good. So again, I'd rinse it, put it back in its cradle. So if I were going to put them around my face, I'd have to really ask myself, do I need 2 of them? It depends on the size of my mouth, obviously. So I would put them here, but make sure when you stick them, you're sticking them as close to the lip, because there's a little bit of an overlap. Once you take off the adhesive, there's a little bit of an overlap. So you want to make sure that you brush your teeth, everything's done, you wash your face, brush your teeth, everything's dry before you do this. So you put these on, and then you'll stick them, and then you'll go to bed. Underneath, you might need 2 also, but notice they have a little bit of an overlap, so next time you might have to overlap them. Let me grab this up here. You might have to overlap them a little bit to the side because of that adhesive on the edge. Same with up top. You kind of just have to think it through and say, Now, if you use just the pair, the 2, then you're going to get the 10 treatments out of it. But if you need to use more, maybe you need to use 2, like 2 packets, which is 2 pairs, then you might only get 5 treatments out of that, and you have to plan accordingly. Maybe you won't do a Monday, Wednesday, Friday for 3 weeks plus 1. You will just do maybe a Monday, Friday for 2 weeks, and then a plus 1. And that way you're still rolling and you're still doing whatever you can to use these, but you just don't get as long of a treatment. And that's just what you have to deal with, I guess. So, but at least you can give it a try to fill those wrinkles in. So tonight, I'm not going to put them around my mouth because that's not my biggest area. I'm going to take this little adhesive off, and now I have my little Band-Aid. So I'm going to do them under my eyes. And what I like to do is I like to scope out kind of where I'm going to put them before I put them there, okay? Because you don't want to keep taking these off. This adhesive is only good for about maximum 2. I've noticed that. I've had to reposition them. I wouldn't want to do it a 3rd time. So I'm going to take them up here and put them close to my eyes. And when I do this, I got to watch my eyelashes, because my lash boost has made my eyelashes grow beautifully, but crazy beauty. And I'm going to tuck them under like this, relax my face, because I don't want the adhesive to kind of have to fight my expression. I'm going to put them on, and then I'm going to roll my finger around the outer edge, just like that, and then push. Gently, gently push the hyaluronic acid and that peptides into my wrinkle area. So I'm going to stick them down. Good, just like that. And now I'm going to take the other one, and I'm going to do the same thing. I'm going to tuck it up there. I'm going to even them out as much as I can, relax my face, and put them down. And rub the adhesive all the way around, and then push it, just like that. Now these need to be on for at least 6 hours, because that's going to give you the maximum benefit of the peptides and the hyaluronic acid going into the eye. So we're going to stick those on and then go to bed. So if I've rolled my whole face, then I can actually take the retinol that the AmpMD, the roller, comes with, and spread it all over my face, my neck, and my upper chest. And that way I've got retinol plus the acute care working. When I put anything around here, I want to make sure that I keep kind of a surface area of at least 1/2 an inch, because as you sleep at night, you don't want the retinol to go under your adhesion, because you don't want it to loosen up. So that is my quick tutorial on how do I use acute care and how do I team it up with the AmpMD roller to get the most out of it. So if you have any questions, reach out to me. You can find me at my phone number 270-933-2953 or Renee F. Golson on Facebook, and I'd love to help you. So have a good night, and I'll talk to you soon. Bye. If I can get it to turn on.